We are starting off with the latest on the Omicron variant, which is now getting detected in different parts of the world. A study by South African scientists suggests that the Omicron variant is 3 times more likely to cause reinfections as compared to the Delta or the Beta strains. The findings, based on data collected by the country's health ministry, form the first set of scientific evidence to shed some light on this new strain. The paper has not yet been peer-reviewed. The study says there were over 35,000 reinfections among 2.8 million people with positive tests until the 27th of November. Cases are considered reinfections if they test positive 90 days apart. But the study did not have information about the individual's vaccination status. Researchers will focus on this next to get a better picture of how deadly this new variant really is. For more on this, our correspondent Calvin Ongmo is joining us live from Limpopo, South Africa. Hi, Calvin, tell us more about the current COVID-19 situation in South Africa.
Yes, so the number of new cases in the country is rising exponentially. In the last 24 hours, the new cases have gone up to 11,535 and 44 new deaths have been reported. 70% of these cases have been reported in the country's economic hub, the Gauteng province. The government says they are working round the clock to ensure there are enough hospital beds and all the necessary medicines required for COVID-19 patients. However, every officials and doctors are reiterating every day for people to get vaccinated. The premier of the province, who is David Makura, said they are preparing for the worst, but said there is no need to panic if more people comes forward to get vaccinated.
Right. What are the health officials on the ground saying at this point? Are they advising that the country should go under a hard lockdown in order to minimize the pressure on the healthcare system?
Yes, so like I said earlier, the government as well as the health officials are preparing for the worst. They say they've dealt with very bad situation last year and it's only going to worsen. One of the doctors I spoke to in the public hospital this morning said to me that suddenly there is a huge rise in hospital admissions, but the symptoms that the patients are showing is very mild as compared to what they saw during the dominance of the Delta variant. Also, he added that it's mostly the young adults and children under 5 years of age that are getting admitted. And as far as your question on the lockdown is concerned, most of the health officials feel that instead of on a tighter lockdown restrictions, government must prioritize on compulsory vaccination, because at this point of time, they are seeing number of unvaccinated people actually getting admitted to hospitals.
WION now available in your country. Download the app now. Get all the news on the move.